Research on COVID-19 is an ongoing process. Understanding the way the virus behaves, spreads and mutates remains a key part of the battle. Let's now get you updates on the latest studies that are underway on the novel coronavirus from around the world. According to researchers from Germany and Italy, footballers and other athletes are at a higher risk of contracting the COVID-19, leading to their lungs getting specifically impacted. Football has ground to a halt in all major leagues around the world. European football's governing body has set 25th May as the deadline for all leagues to outline plans to restart. However, the lungs of athletes with their higher capacity to inhale during strenuous exercise are at a particular risk. Especially, the lower part of the lungs can get badly infected. This can result in permanent lung damage, complications such as pneumonia, and in some cases, acute respiratory distress syndrome. Even in cases where athletes are asymptomatic, they can end up infecting others during a game where they can come in close contact. In fact, many footballers exhibited symptoms such as fever, dry cough, and respiratory distress in the immediate aftermath of their last match. One of the major impediments of testing is the scarcity of solutions which are used to store sampling swabs. To work around this challenge, researchers at the University of Washington in Seattle are experimenting with dry swabs to detect the viral RNA. In the preliminary research, the dry swab extraction correctly detected the viral RNA 9 out of 11 times, while the success rate of the conventional swab extraction method yielded the correct result only 8 out of 11 times. If adopted, the dry testing protocol could ramp up the ability to test significantly. Has COVID-19 become an airborne disease? Initial research has pointed out that novel coronavirus infection spreads only through contact spreading. But the latest research at the Wuhan University suggests that the novel coronavirus can travel through air in the form of minute particles exhaled by an infected patient. Small confined spaces such as hospital toilets, elevators, staff changing rooms, etc. showed a higher prevalence of the viral RNA. But in the better ventilated patient wards, the presence of the viral RNA was minimal. The research points out that the coronavirus can get transmitted when an infected patient sneezes, coughs, or even breathes in the form of fine aerosols. But routine disinfection and better ventilation substantially lowers the risk of transmission.